Hello everyone, I'm Dr. Preeti. I'm currently working at NHS in the Department of Emergency Medicine as a Senior Clinical Fellow. I am today here to present one of my studies which I published in the International Journal of Community Medicine and Public Health. It was a one-year record-based study published in the year 2016. Please bear with me. I will be beginning with my slides now. So, with the help of my colleague and Associate Professor Dr. Deepthi, Department of Community Medicine, JN Medical College, Belgavi, Karnataka, we conducted a study on retrospective analysis of tubectomy beneficiaries in a primary health center of a rural area, KINAYE. It was a one-year record-based study conducted during the period of April 2015 to 2016. Introduction. As we all know, population explosion is the leading problem of most of the developing countries. If I talk about my own country, we have seen the surge of around 171 million population during the decade 2011 to 2021 during the census. We are aware that there are various contraceptive methods being widely used by various groups of the society, and female sterilization tops it all, becoming 24% globally, intrauterine devices 17%, male sterilization at 2% globally. So we felt the need of conducting a study to know what are the influencing factors which are influencing a particular section of the society to undergo tubectomies of a rural area. Coming to the objectives and methods of the study, as I said before, we conducted this study in a rural population of a primary health center, which contains 9 sub-centers and is covering a population of around 80,000, which is a large population. When we were analyzing the records and the data, we came to know about different variables which were connected to the beneficiaries who were undergoing tubectomies, like the age of the beneficiary, age of their partners, religion, education status of the beneficiary and their partners, total number of living children, number of sons, number of daughters, the socioeconomic status. We collected the record of around 200 beneficiaries from the primary health center for the period between 2015 to 2016. Now I will be presenting the data collected in a tabular format. Coming to the first table of distribution of beneficiaries as per their age group. Around 57% of the population was falling between the age group of 25 to 29 of the reproductive age group. Around 33.5% population was between 20 to 24. 8.5% population was between 30 to 34 years of age group. 1% of the population was having the age more than 34 years. So here we can see that around 57% of the population or the beneficiary were completing their families between the age group of 25 to 29. Next, coming to the age groups of the partners of the beneficiaries, we can see here around 81% of the population was between the age group of 30 to 34 years, followed by a 12.5% population more than 34 years, 5.5% 25 to 29 years of age group, and 1% between 20 to 24% of the age group. So we can see here that male counterparts were elder to the female counterparts and they were completing their families at a later age. Now coming to the religion of the beneficiaries. We can see here around 95% of the population were belonging to the Hindu community, 4.5% the Muslim community, and 0.5% belong to other communities. Next is the distribution of beneficiaries as per their educational status. Around 61.5% of the population was having secondary education, followed by 29% having primary education, 6.5% were illiterates, 2.5% having diploma, and 0.5% had gone to the college and were having the degrees. So here we can see that around 62% of the population was having some kind of education. They were not illiterates, and they were knowing this. Yes, this is the importance of undergoing sterilization, and this is the importance of accepting a particular method of contraception. Now coming to the educational status of the beneficiaries partners. We can see here around 57% of the population were having secondary education, 29% with primary education, 8% being illiterates, 6% having the diploma, and 1% had gone to the college and were having the degrees. So again, the major section of the society were having some kind of education, and they were knowing the importance of maintaining and managing a small family. Now, coming to the socioeconomic status of the beneficiaries. Around 60% of the population was below poverty line and 40% population was above poverty line. So again here, keeping in mind their socioeconomic status, majority of the section was from below poverty line who were accepting the female sterilization. Coming to the distribution of participants as per their total number of living children. Around 55.5% of the population were having 2 children, 37% having 3 children, 6.5% having 4 children, and 1% having 5 children. So it shows here that maximum population were completing their family after having 2 number of children. Now let's see the distribution of participants as per number of male children. Around 58% of the population were having 1 male child, 33.5% having 2 male children, 6% having no male child, and 2.5% having 3 male children. So here we can see, yeah, that majority of the section was completing their family after having a 1 male child. Now let's see the distribution of participants according to the type of tubectomy. 90% of the population were accepting interval type of tubectomy and 10% accepting peripheral type of tubectomy. 90% of the population were accepting interval as because of the postpartum complications, they were accepting it after 6 to 10 weeks of delivery. After seeing all the data in tabular format, we come to a conclusion that more than half of the beneficiaries were in the age group of 24 to 29 years of reproductive age group. More than 2/3 of the beneficiaries' partners were in the age group of 30 to 34 years. This shows that they were completing their family by this age. Maximum number of beneficiaries were belonging to Hindu religion. More than 2/3 of the beneficiaries and their partners had received primary education along with the secondary education. Understanding the implications and effects of having a big family over a small family on their socio-economic status and by and large the economic status of a country. Majority of the participants were belonging to below poverty lines. Now, the acceptance of tubectomy was seen more among the beneficiaries who were having at least 1 male child, and the beneficiaries having no female child were more inclined towards the family planning as compared to families having tubectomy with no male child. So this shows here some kind of gender bias also, that with 1 male child, the beneficiaries were completing their family. We have taken into consideration the data provided by national programs under the Ministry of Health and Family Welfare. We compared the data with another International Institute for Population Sciences, National Family Health Surveys 3 and 4, and the latest one, which was conducted between 2019 to 2021, which again says that female sterilization tops all other kinds of contraceptive methods. I also need to mention about various different aspects of the study. There were no conflicts of interest, exemptions were obtained for the study, and no consents were applicable. Here now I also need to focus on why there was a need for this study. I believe It was required to understand the pattern in the rural population accepted by a particular section of the society who were favoring female sterilization over any other different type of contraception. And also there was a requirement to know at what age of their reproductive age, at what age they were completing their families. As every study has a strength, we also had few strengths in our study. Like the data we collected, it was a random collection, and it was collected for the whole population of a primary health center over a period of 1 year. We also had few weaknesses which I came across. Number one, it was a record-based study. If it would have been direct interviews with the beneficiaries, we could have gone more into depths of other influencing factors. When we have direct interviews with the participant, we come to know other variables as well. So I have few recommendations also for future aspects of this study. We can involve more women and medical colleges to spread the awareness about different types of contraceptions as well. Like male contraception, male sterilization is also available, but very less section of the society is going for male contraception, in spite of giving and in spite of increasing the incentives for male sterilization. National Family Health Survey data 4, which was conducted between 2019 and 2021, it came to notice that in spite of increasing the incentives for male sterilization, again, it becomes the female sterilization which is widely being accepted. Coming to the end of the presentation, we authors are grateful to Dr. Manchetti, the Principal, GN Medical College, Dr. S.M. Katti, the Head of the Department of Community Medicine, Dr. Shivswamy, Professor of Community Medicine, Dr. Deepti, my Associate Professor, who guided me throughout the project, Dr. Dhanwalkar, Medical Officer of the Primary Health Center KINAYE, the interns who were posted during that period in the PHC KINAYE, for helping us out in data collection. Now, I also take this opportunity to thank the audience and the organizers of this SciTech Central conferences for giving me this opportunity to present my publication. Thank you, everyone. Thank you all.